I've been asked to address some questions in particular, which I think will be of interest. And so I'll start with those. The first one is this issue of the Delta variant. Is it more contagious? What do we know about the Delta variant? Well, it's currently the predominant strain in the United States. It is more contagious. Some of the information out there suggests that it's probably twice as contagious as the previous variants of COVID. The Delta variant is still coronavirus. It's not a new virus. It's still the same virus. It just has slightly different genetics. And viruses do this. They mutate all the time. And it really has nothing to do with the vaccine. It's just what viruses do. And so the longer that we have this pandemic among us, the more variants we will have. But currently, the Delta variant is the predominant one. And it is very contagious. In fact, near the end of July, the CDC made some new recommendations regarding masking based on some alarming data about the increase in cases. So in late June, the 7-day average of COVID-19 cases was about 12,000. This is nationally. At the end of July, the 7-day average was 60,000, which is close to what it was before the vaccine was even available for people to get. And it was thought that this Delta variant was responsible for the large increase in cases. So the new recommendation from the CDC was to wear masks in public, in indoor places, whether you're vaccinated or unvaccinated. And in particular, you should do this if you're in an area of high or substantial transmission. So whether or not Iowa would be considered a high or substantial transmission right now is, I guess, debatable. But certainly there are places in this country like the South and the Southeast where they are dealing with very high numbers of COVID. And so masking indoors, whether vaccinated or unvaccinated, is a current recommendation. This Delta variant may cause more severe illness. There's studies from Canada and Scotland that suggest that you're more likely to be hospitalized if you get infected with the Delta variant. The vaccinated and the unvaccinated people out there can transmit this Delta variant to other people. But if you're vaccinated, your infectious period, your time that you'll be shedding that virus, usually will last for a shorter time than if you're unvaccinated. So the primary concern with the Delta variant is people that are unvaccinated or people who have never been infected with COVID, essentially because they have no immunity and they're very vulnerable that way.